Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. As reported in Science on July 21st, 2022, drugs created thus far to block the formation of beta amyloid plaque have proven to be very unsuccessful in preventing or treating Alzheimer's disease. So after commenting on the failed clinical trials using these drugs in the publication Neuroscience News on August 1st, 2022, Dr. Henry Paulson, who's an MD and PhD, a professor of neurology, and who directs the Michigan Alzheimer's Center, stated, and I quote, even though we're looking at these drugs as sort of, going to be the miracle solution to Alzheimer's disease, so far these things haven't happened. So what he said was this: there's plenty of evidence that middle-aged and older adults who want to reduce the risk of dementia or slow its onset should focus on healthy habits like sleep, nutrition, exercise, social engagement, and controlling blood pressure and cholesterol levels. The role of lifelong education and learning, whether informal or formal, is also very clear. People who keep their brains active and they keep learning things throughout their entire life, their brains do better as they get older. He was making the point that we're all caught up in trying to find a drug to prevent Alzheimer's disease, which still looks like it's many years down the road. In the meantime, we often neglect the clear-cut evidence showing that a person's day-to-day diet and lifestyle are critically important in determining risk for Alzheimer's disease in many cases. So to that end, a large 2020 meta-analysis study published in the journal Brain Science showed that when you combine all the evidence, you see that people who have high total cholesterol, and especially people with high LDL cholesterol, the bad cholesterol, are at much higher risk of developing Alzheimer's disease. As they indicated, high LDL cholesterol should be considered an independent risk factor for Alzheimer's disease development. Now, there's other diet and lifestyle things that contribute to Alzheimer's disease, we think, but high LDL cholesterol should be considered an independent risk factor. Presumably, LDL cholesterol, when it's high, increases Alzheimer's disease by clogging arteries in the brain and also the carotid arteries, and may also promote other inflammatory problems in the brain itself. In their concluding remarks, the researchers stated, and I quote, "Cholesterol is a modifiable risk factor, so if health professionals know the relationship between cholesterol and Alzheimer's disease, they could try to modify cholesterol levels to help reduce Alzheimer's risk." This study provides empirical evidence for the reduction of LDL cholesterol through the promotion of healthy lifestyle, such as diet, weight loss, physical activity, and or the use of prescription drugs when necessary. My own recommendation is first that you know your blood LDL cholesterol level. If it's above 2.0 millimoles per liter or 77 milligrams per deciliter, then you should work harder to keep cholesterol-raising foods out of your diet, which are foods that are typically high in saturated fat, trans fats, deep-fried foods, breaded foods. For the most part, those are the foods that tend to push LDL cholesterol higher. In fact, even if your cholesterol levels are good, avoiding these foods really provides other health benefits. So everyone should really be trying to avoid these foods in the long run. So I've included the scientific references for this information in the text below. Thanks for watching, and I'll see you next time.